Medicaid. So what is Medicaid? It was added into the Social Security Act of 1935, just like Medicare, in 1965, and it became Title 19 of the Social Security Act. Simply defined, it is a basic insurance coverage for low-income individuals. It covers both health insurance, health coverage, as well as long-term care. It's a huge revenue source for safety net health providers. If you remember, we discussed what safety net health providers are, and these are those providers, both facilities and healthcare providers themselves, health professionals, that provide healthcare services in underserved areas. Medicaid is very important to state economies because it provides a lot of jobs through the clinics and other healthcare facilities that derive revenue from the program. And it is operated in more than 50 states and territories, that includes District of Columbia. So territories like Guam, the Commonwealth of Puerto Rico, they do have their own Medicaid program, and each has its own policies. However, there is an overarching federal set of policies that each state or territory has to adhere to. How is Medicaid financed? It is financed jointly by the federal and the state governments. So the federal, as I've mentioned in the previous slides, the federal government has broad requirements on how to operate your own Medicaid program. But and because of these, states have wide discretion on operations. As a matter of fact, states can ask for waivers from the federal government to operate outside of the federal guidelines. For instance, either broaden the eligibility, like you have to include more people, or also include provisions such as work requirements for people in Medicaid. So there are some states that have done this. Kentucky is one. And this waiver is granted by the Secretary of the Department of Health and Human Services. Now, states can also charge premiums, and this is according to the wide discretion that they have. That means there are states who operate Medicaid programs where there is a monthly premium. It's probably negligible, but it's still money that comes out of pocket from recipients. And states can also put in place cost-sharing mechanisms, but both premiums and cost-sharing, out-of-pocket cost from recipients or from people that are covered by Medicaid, the amount is subject to federal limitations. So that is under the requirements of the federal government. One thing we need to remember is that Medicaid is not a healthcare delivery system. Instead, it is a health coverage program. Why is it not a healthcare delivery system? Well, it does not own hospitals. It does not operate clinics. It does not employ doctors. It is a source of payment. It is a third-party payer source for fee-for-service or managed care. Most Medicaid coverages now are managed care. So, you call those managed care Medicaid plans, for instance. So each insurance company that participate will have their own Medicaid plan. And they try to compete against each other so that in some states, for instance, people that are entitled to Medicaid have a huge leeway in choosing which managed care Medicaid they're going to choose. There are people who are dually eligible for both Medicaid and Medicare. If you are under Medicare and you're also eligible for Medicaid, the role of Medicaid in this case, the Medicaid steps in as the one that will pay for your premiums, your out-of-pockets, your premiums and other out-of-pockets, co-insurance, all those other out-of-pocket expenses. People that are covered under Medicare will have to shell out. Another thing is that 10 years ago, the Affordable Care Act mandated that all states should expand their Medicaid programs. So you've probably heard a lot about this, what Medicaid expansion is all about. You'll have a fuller understanding of this when we discuss the federal poverty tables, federal poverty level tables later on in this lesson. So Medicaid is available for people whose threshold of income is 133% above the poverty level. Okay, so that's 33% above the federal poverty level. And we'll explain that later. Expansion meant that if you're a state that will agree to expand your Medicaid program, you'll have to increase it to 138% of poverty level. Back in June of 2012, the United States Supreme Court issued a ruling that because Medicaid is a program that is managed both by the federal government and the state, therefore the state can also and should have the right and be given the option if they want to or not in terms of expanding their Medicaid program. That means Medicaid expansion will have to be approved by the state legislative body. And as we have seen in recent years, there has been actions from the grassroots level, meaning citizens basically able to gather enough signatures to include Medicaid expansion in the ballot in the form of a referendum. As of March 2020, there are 37 states, including the District of Columbia, that have expanded their own Medicaid program. And of course, New York is one of them. We were one of the first that expanded our Medicaid program right after the Affordable Care Act said it needs to be done. And at this point, there are 14 states that have not expanded their Medicaid program. If you are a state that agreed to expand your Medicaid program under the Affordable Care Act or Obamacare, the federal government is supposed to cover 100% of the additional funds that you will need for the additional people that you will cover by increasing your eligibility. And that was supposed to cover 3 years, from 2014 to 2016. That has already lapsed. But until 2022, states that expanded their Medicaid program are still supposed to get support from the federal government, which is at least 90 to 93% of their additional cost if they have expanded their Medicaid program. This is a map. This is the current map of the states all over USA, the contiguous states, as well as Alaska, Hawaii. And you could tell that at the start, it was really divided among party lines. Most states that first adopted Medicaid expansion were the blue states, or the states that are progressive leaning or politically controlled by Democrats. But as you notice, there are now a lot of known Republican states, such as Arizona, Utah, that have expanded their Medicaid program. If you live in a state that has not expanded their Medicaid program, this is the standard, you will be eligible for Medicaid if you earn up to 133% of the federal poverty level. So these are basically the people that are covered. And to introduce the federal poverty level, the next slide, first let's understand what poverty line is, or being at 100% federal poverty level. Now, being at 100% poverty level means that you or your household just earn enough to buy things in order to live. Necessities, being able to afford the necessities of life. Rent, a roof over your head, clothes on your back, food on the table, basic things. Never mind vacations, never mind other extra expenses. This is the federal poverty level table. Now, this is a lot of information, so bear with me as I explain this table. So in this first column, you will see the number of persons in the household. So 1, 2, 3, and so on. 1 means you're a single person. This is either you or a child or you and a spouse. It's literally household. So 100% federal poverty level, if this is what you earn as an individual. By the way, this table is applicable to the 48 contiguous states. Alaska and Hawaii have a higher federal poverty level because of their standard of living is higher, meaning their expenses tend to be higher than the 48 contiguous states. Now, that's also arguable because for New York City, for instance, this is really a very low income. But say, for instance, if you live in some rural states like Mississippi or Alabama, this is, in terms of standard of living, this would be worth more than what it is in terms of daily existence in an urban city, say, for instance, like New York City. Okay, going back to federal poverty level. You are at 100% federal poverty level, meaning you are living on the poverty line if this is your income and this is the number of people in your household. So in New York City, you're considered at 100% poverty level if you earn $12,760. If you live in a state that did not expand Medicaid, this is the threshold income that will make you eligible. Now, for states like New York, because we have expanded, this is the threshold at 138 federal poverty level. So let's take a look at this first. This is 100%, right? So if this is 133%, that means this is 33% above the 100%. That's why it's 133%, which means if this is 100%, you multiply this by 33% or 0.33 and add the resulting amount to the 100%, it results to 16,971, meaning you're allowed a leeway. You're allowed to earn 33% more and still qualify for Medicaid, or 38% more than this to qualify for Medicaid if you live in a state that has expanded its Medicaid program. This is for the marketplace. This is if you have to buy your own health insurance in the marketplace in Obamacare. We will talk more about this, but based on the explanation I gave you guys, you should be able to deduce that this is 400% above this. That means you would still get government subsidy if you buy your own health insurance if you're a single individual, and this is what you earn in 2020. What does Medicaid cover? So if you recall, I said that the federal government has certain requirements. This is one of the requirements. The federal government says if you're going to operate your own Medicaid program, these are the mandatory services that you should provide. Physician services, hospital services, lab, screening, and medical and surgical dental services. Also, you should pay for federally qualified health center services. When we talk about primary care and outpatient care, we're going to talk about federally qualified health centers. Family planning is also included as a mandatory service that need to be covered by Medicaid. Pediatric and family nurse practitioner services, nurse midwife services, nursing care facility services for individuals 21 and older, and home health care for persons that are eligible for nursing facilities. These are optional services, meaning states do not have to offer the services, but for the most part, a lot of states do anyway. And if you live in a state that has a more liberal view on social services, chances are they would cover these optional services. Who pays for Medicaid? So because this is a joint program by the federal government and the state, it is a 50-50 dollar for dollar matching arrangement. So if you as a state can raise 50 cents, the federal government is going to give you another 50 cents. So it's 50-50. However, there are states that cannot afford to do the 50-50 arrangement. So some poorer states actually just put on a share of 24 cents to a dollar, sometimes 25 cents to a dollar, with 75% being covered by the federal government. States allocate as much as 18% of its yearly expenditure to Medicaid, and it's always the second largest budget item for state budgets. Because Medicaid, and just like Medicare, is under a lot of scrutiny because of a lot of incidences of fraud, for instance. There is a government entity that runs the Medicaid program, and it's the Center for Medicaid and State Operations. So it develops and implements quality initiatives for the state programs. It also provides technical assistance to states for how they will do their or perform or run their quality improvement initiatives. What are these initiatives and what do they target? So first is evidence-based care. So meaning if you are a state that operates a Medicaid program, you should espouse evidence-based care, meaning care given to patients that are based on scientifically sound practices. There's also quality strategies for pay for performance, meaning it's sort of a bonus, for instance, for providers for taking care of their patients. Say, for instance, diabetics whose blood sugar is under control, primary care providers can actually receive bonuses for that. The promotion of health information technology, the use of electronic health records, and health information in terms of information in labs, patient vitals, and all sorts. Also, Medicaid encourages partnerships with internal and external expert organizations. So we're talking about the American Heart Association, the American Diabetes Association, so on and so forth. Medicaid also provides support to states in terms of disseminating information and providing technical assistance. And lastly, Medicaid expects states, if they are running their own Medicaid program, to have quality initiatives that will reduce healthcare disparities. If you remember in chapter 2, we talked about healthcare inequity, healthcare inequalities that result in healthcare disparities.